Order. I will call Esther McVeigh to move the motion. I will then call the Minister to respond. There will not be an opportunity for the member in charge to wind up, as is the convention for 30-minute debates. Order. Esther McVeigh to move the motion.
I beg to move that this House has considered the risk of suicide and mental health of young people in Tatton. And may I say it's a pleasure to speak under your chairmanship today, Mr Dowd, and I would like to convey my appreciation to the Minister for replying to this extremely important and sensitive debate. The management of withdrawal from antidepressant medication, specifically selective serotonin reuptake inhibitors, SSRIs, and the profound impact this process can have on the mental health and suicide risk of young people. I would like to begin by conveying my sincere thanks to my constituent Gina Russell, who met with me and bravely shared the experience of her daughter Olivia, who tragically took her life in September 2021 following withdrawal from SSRI medication. Olivia's mum is unable to be with us in Westminster Hall today. However, I know that she and her family are watching this debate at home, for they are determined to help prevent others having to suffer the same fate as Olivia. I would also like to place on record my thanks to the charities Mind, Rethink Mental Illness, the Prevention of Young Suicide, as well as the Children and Young People's Mental Health Coalition and the House of Commons Library for the information provided to me ahead of this debate. While the information was insightful, it was deeply disturbing, for it revealed Olivia's experience of declining mental health as medication withdrawn was far from unique and was a known risk, which made me determined to pursue this debate on behalf of her family and so bring Olivia's story and her family's suffering to a wider audience. Let me start by painting a picture of Olivia, who was an intelligent, creative and hard-working 25-year-old who just left Tatton to come and live in London. Her parents remember her as wonderful, vibrant and a loving daughter, and also as a loving younger sister to her brother Luke, a cherished and adored granddaughter, and a loyal, kind and supportive friend. She lit up a room and was admired by all who knew and loved her. Then, in November 2020, during the pandemic, Olivia became anxious and began taking SSRIs, citalopram, to manage this anxiety. Initially, Olivia responded well to treatment. However, when the time came to discontinue the medication in June 2021, she experienced a rapid decline in her mental health, one far worse than she had previously faced. She then resumed SSRI in August 2021, finally taking her life in September 2021. When she first came off her medication, it was without consulting her GP because she was feeling better. But she should have been warned about stopping taking the antidepressant. The family were later to discover that citalopram is one of the most difficult antidepressants to come off. Tragically, the Royal College of Psychiatrists suggests that between 1/3 and 1/2 of people who take antidepressant medications will experience withdrawal symptoms to some extent. The severity and duration of these symptoms and who they will affect, though, is not certain. In Olivia's case, the withdrawal symptoms were severe, and the resulting deterioration in her mental state ultimately led to her taking her own life. Bear in mind, suicide remains the leading cause of death among young people under 35 in the UK, and the mental health of young people has declined alarmingly in recent years. I will indeed.
Mr. Chairman, can I commend Donna Lady for the very sensitive and way that she's delivering this speech today. In Northern Ireland, the worrying thing about suicides, we've had 8% increase in last year, and it worries me greatly why people are unable to cope with life. But does anybody not agree that the inability of GPs, and I think she referred to that, to refer patients to early intervention mental health is something which must be tackled? And that early support for our young people and easy access to the support is the only way to give lifelong tools to those who are struggling from a very young age. Thank you.
Mr McVeigh.
I want to thank my honourable colleague and friend for that pertinent intervention. And the pandemic lockdown exacerbated this mental health crisis, for it brought isolation, uncertainty and disrupted routines at home, in education and in the workplace, taking an immense toll on young people's well-being. And during this period, the use of antidepressants, including SSRIs, rose significantly. Meanwhile, access to in-person medical support was often severely limited, which may have worsened the challenges faced by patients navigating their mental health and medication. The closure last year of England's only dedicated antidepressant withdrawal helpline, the Bristol Tranquilizer Project, has left a further gap in support services for patients, and this is at a time when mental health services are under immense strain. Analysis from the Children and Young People's Mental Health Coalition shows that 1.5 million children and young people could need new or increased mental health support as a result of the pandemic. These factors combined create a perfect storm for young people struggling with mental health challenges, with many being prescribed SSRI medication as a solution for their medical practitioners, by their medical practitioners. It is important to note the life-changing and positive impact that this medication has had on many people across the country. So I do not seek to contest this, or the ability for these medications to vastly improve the mental health of many patients. However, we must also acknowledge that the process of withdrawing from SSRIs can be fraught with challenges that leave patients vulnerable. In Olivia's case, her family believed that she was left in the dark. Her mother recalls that the information provided by her GP was limited and did not adequately warn of the risks of sudden or poorly managed withdrawal. Owing to this, the exceptional decision was taken by the coroner following her death to produce a prevention of future deaths report. It found no evidence that Olivia was explicitly warned about the risks of relapse, the potential signs of withdrawal, or told she might feel worse before feeling better. The report concluded that while advice may have been given, this was not conclusive, and concern was raised regarding the inconsistency of advice that each GP would give patients. The report could not say with confidence that every GP within Olivia's practice was discussing the key risks associated with the SSRI medication withdrawal. I feel, Mr Dowd, that this requires our immediate attention, as the principle of informed consent, which underpins our healthcare system, requires that patients are fully aware of the benefits and risks of any medical procedure or treatment. The General Medical Council, GMC's professional standards for decision-making and consent stipulates that doctors' discussions recognise the effect of the patient's individual clinical circumstances on the probability of the benefit or harm occurring. Guidance from the GMC acknowledges that the amount of information doctors provide to patients can vary due to time constraints. Where such time constraints exist, doctors are encouraged to involve other medical professionals, such as clinicians, or to refer patients to the patient information leaflet accompanying their medication. Patients are legally entitled to a patient information leaflet with their prescriptions, but the responsibility for providing this lies with pharmacies. This places the onus on patients, potentially in a vulnerable position, to navigate complex decisions alone. These leaflets are often lengthy and rely on a patient both reading and understanding the information provided. The issue is compounded by outdated guidance. Until recently, the National Institute for Health and Care Excellent NICE guidance suggested that withdrawal symptoms typically last 1 to 2 weeks. This has now been updated to reflect that symptoms can be more severe and prolonged, but these updates have not yet translated into comprehensive systematic changes to ensure patients are adequately supported. Inconsistent guidance on antidepressant withdrawal has resulted in many patients experiencing distressing, debilitating symptoms. Patients have been misdiagnosed as suffering from a relapse of their original mental health condition, and others left fearful at stopping using their antidepressants. This may have contributed to many individuals staying on their antidepressant medication longer than is necessary, with a report in 2023 suggesting that 2 million people are taking antidepressants for 5 years or more. So what improvements can be made to ensure the better facilitation of SSRI withdrawal? Olivia's family believe that there are measures that could be taken that would go far in protecting patients when withdrawing from this medication. A move as simple as replacing a warning label on the packaging of SSRI prescriptions would be a straightforward way to convey the dangers of the medication. This would not replace the more comprehensive information provided in a patient information leaflet or the guidance of a GP. It would, however, act as a safeguard in circumstances should those fail. The safety of patients' prescribed medications must be guaranteed, not left to chance based on appointment time constraints or whether a patient has read in full the often lengthy patient information leaflet. The story of Olivia and her family is a painful reminder of the urgent need to address the risks associated with SSRI withdrawal and the broader mental health crisis facing young people today. While SSRIs have transformed countless lives, we cannot overlook the vulnerability of those navigating withdrawal. We owe it to families like Olivia's to ensure that no one feels unsupported or uninformed when taking such important decisions. Simple measures such as enhanced warnings on medication packages, improved guidance for medical practitioners, and comprehensive advice can make the process of withdrawal palpably easier and safer, potentially offering better outcomes for individuals navigating this complex process from withdrawal of SSR medication. I would be grateful for the Minister's consideration on those issues I've discussed. And finally, in this instance, the coroner produced a prevention of future deaths report. So can I ask the Minister, how does such a report become wholesale advice to the medical profession? And would he work with me to make sure that it does, in order to prevent lives like Olivia's being cut so tragically short?
This House has considered the matter of suicide and mental health for young people in Tatton constituency. Minister.
Thank you very much indeed, Mr Dowden. It's a pleasure to serve under your chairmanship, and I'm very, very grateful indeed to the Right Honourable Lady, the member for Tatton, for securing this debate and for raising so many important issues. I'd also like to thank her for sharing the tragic story of Olivia, and my heart certainly goes out to Olivia's family and loved ones for what is a truly heartbreaking situation and process that they've gone through. The Right Honourable Lady made a number of very, very important points about withdrawal from SSRI antidepressants. A number of those points are quite specific, and I don't have in my notes here specific responses to those specific questions. So with her leave, I would like very much to write to her with responses specifically on those points. And she made a point as well about the coroner's advice, and it seems that contained a lot of very useful counsel in terms of how we might address and tackle the specific issues that she raises. So I'll certainly look at that in detail, and I'd be more than happy to take those matters forward with her. We have a shared interest in addressing this, and clearly if the system isn't working and people who are on this antidepressant are not being supported in terms of withdrawal, that is something that we need to look at in detail, and we need to tackle it. I absolutely share her views on that. Turning maybe to some of the more general points that I was wanting to make about the government's position on mental health. we have made suicide prevention and mental health a priority, especially for young people. Many of the issues raised today are symptomatic of an NHS that is broken. Looking at the figures, the challenges that face the NHS truly are sobering. Around 50% of lifetime mental health conditions are established by the time an individual is aged 14, and 75% by the age of 24. Evidence suggests the prevalence of mental health conditions is rising among children and young people. In 2023, 20.3% of all 8 to 16-year-olds had a probable disorder compared to 12.5% in 2017. The COVID-19 pandemic has, of course, exacerbated needs, with analysis showing that 1.5 million children and young people under the age of 18 could need new or increased mental health support following the COVID-19 pandemic. According to the Darcy review, some 343,000 referrals for children and young people under the age of 18 are waiting for mental health services, including around 109,000 referrals waiting for more than a year. Within NHS Cheshire and Merseyside ICB, as of the end of September 2024, 10% of children and young people still waiting for first contact with NHS-funded MH services had been waiting more than 951 days, equating to 1,301 people. Half of those still waiting had been waiting for more than 300 days. There are 13,010 children and young people still waiting for first contact with NHS-funded mental health services. Until recently, there's been an upward trend in suicide rates for children and young people. In women between the ages of 10 and 24, the rate has nearly doubled since 2012, rising from 1.6 per 100,000 to 3.1 per 100,000 in 2023.
Will the Minister give way?
I will give way.
I thank the Minister for giving way. Over the last 10 years, one student has died in England and Wales every 4 days as a result of suicide. And yet, despite this forlorn tragedy, the law remains very unclear in relation to what duties and responsibilities universities have in relation to their often very vulnerable young students. So would the Minister meet with me and members of the Learn Network and For the 100 to discuss the introduction of a statutory duty of care on all higher education providers?
I thank the Honourable Lady for that very important intervention, and of course I'd be happy to meet with her and the Learn Network. The government can't do all of this alone. We need to work in partnership with all sorts of different stakeholders, including universities and the higher education sector, and so absolutely we would support any partnership working that we can do. Until recently, there's been an upward trend in suicide rates for children and young people. In women between the ages of 10 and 24, the rate has almost doubled. But the trend for children and young people has flattened in the last year, despite overall increases in suicides. Although these rates are low compared to other age groups, children and young people are a priority group in our mission to tackle suicide. The Department is commissioning research via the National Institute for Health and Care Research to advance our understanding of why rates of suicide have been increasing in certain age groups. We are committed to reforming the NHS to ensure that we give mental health the same attention and focus as physical health. It's unacceptable that too many children, young people and adults are not receiving the mental health care that they need. And we know that waits for mental health services are far too long. We are determined to change that. That is why we will recruit 8,500 additional mental health workers across children and adult mental health services. We will also introduce a specialist mental health professional in every school and roll out Young Futures hubs to provide timely mental health support to our children and young people. We're working with our colleagues at NHS England and the Department for Education as we plan delivery of these commitments. Furthermore, this government has also committed to tackling suicide as one of the biggest killers in our country. The Suicide Prevention Strategy proposes targeted support for priority groups such as children and young people. The Department for Education is currently reviewing the RSHE statutory guidance, and the Secretary of State for Education is clear that children's well-being should be at the heart of it. 79 organisations up and down the country have been allocated funding from DHSC's £10 million Suicide Prevention VCSE grant fund over the 2 years to March 2025. These organisations, from local, community-led through to national, are delivering a broad and diverse range of activity that will prevent suicides and save lives. Early intervention on mental health issues is vital if we want to stop young people from reaching crisis point. Schools and colleges play an important role in this early support, which is why we've committed to providing a mental health professional at every school. We know that mental health support teams help meet the mental health needs of children and young people in education settings. These are available in schools in Tatton, and they are made up of mental health practitioners and education mental health specialists. However, it is not enough to provide access to a mental health professional when young people are struggling. We want the education system to set young people up to thrive, and we know that schools and colleges can have a profound impact in promoting good mental health and well-being. Doing this well takes a holistic approach, drawing in many aspects of the school or college's provision. I know that there are many schools who already do this, and my department is working alongside the Department for Education to understand how we can support good practice like this across the sector and across the length and breadth of our country. The Opportunity Mission will break the link between people's background and their success. The mission will build opportunity for all by giving every child the best start in life, high-quality early education, early child health, home learning environment and family support. The mission will also support them to achieve and thrive, high school standards with a broad curriculum, excellent teachers and targeted interventions, inclusive approach to SEND, mental health support, access to arts, culture and sport, youth services and provision. The government manifesto, our manifesto, commits to rolling out Young Futures hubs, and this national network is expected to bring local services together, deliver support for teenagers at risk of being drawn into crime or facing mental health challenges, and, where appropriate, deliver universal youth provision. They will provide open access mental health support for children and young people in every community. Now, we are concerned about the widespread availability of harmful content online, promoting content such as eating disorders, suicide and self-harm, and which can easily be accessed by people who may be young and/or vulnerable. We have been clear that the government's priority is the effective implementation of the Online Safety Act, so those who use social media, especially children, can benefit from its wide-ranging protections as soon in their lives as possible. Earlier this year, Ofcom concluded its consultations on the draft Illegal Content and Child Safety Codes of Practice. We expect the illegal content codes to be in effect by spring 2025, with the child safety codes following in the summer. Turning now to other aspects of our plans to improve mental health services. The Mental Health Bill, which was announced in the King's Speech, will deliver the government's manifesto commitment to modernise the Mental Health Act of 1983. It will give patients greater choice, autonomy, enhanced rights and support, and aims to ensure everyone is treated with dignity and respect throughout their treatment. It is important to get the balance right to ensure that people get the support and treatment they need when necessary for their own protection and of others. I'm pleased to say that the bill has been introduced in the Lords and will be coming to the Commons in the new year. The bill will make the Mental Health Act fit for the 21st century, redressing the balance of power from the system to the patient and ensuring people with the most severe mental health conditions get better, more personalised care. It will limit the scope to detain people with a learning disability and autistic people under the Act unless they have a co-occurring mental health disorder that needs hospital treatment. So, Mr. Dowd, allow me to conclude by once again commending the Right Honourable Lady for securing this debate today, and to colleagues from across the House who brought their insights through their interventions on this vital issue of suicide prevention and mental health care for children and young people. I'm very committed to working with the Right Honourable Lady and her honourable friend to take some of these issues forward, and I hope that we can together across the House address this vitally important issue. Thank you very much.
Thank you. The question is that this House has considered the matter of suicide and mental health of young people in Tatton constituency. As many as of that opinion say aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order. Order.